Hello students, welcome to this session on course on basics of blood bank. Hello students, welcome to this session. So we will see today the blood bank procedures in that grouping, blood grouping, cross matching and Coombs test and their different types.
Now methods of ABO blood grouping. So they are mainly two methods, forward and reverse. So forward is also called as cell grouping and reverse is also called as serum grouping. So in forward or serum grouping we have to take cell suspension RBC of the patient and then we have to add known antiseras. And in serum grouping you have to take serum of the patient and you have to add known cells of the from the kit. So and then we will see the clumps. And for RH blood grouping only forward grouping is there, that is cell grouping. Reverse grouping is not there because natural and anti-D antibodies are not there. So now in short, principle of blood grouping is when antigen and antisera they are mixed together, they forms agglutination or clumps and then we can decide the blood group. So in short, forward method it can be done on slide or tube method. So you have to take one drop of blood and then one drop of known antisera, that is anti-A, anti-B, and add these two, wait for 2 minutes and see for the clumps. So if the clumps present in anti-A and no clumps seen in anti-B, then it is A group. If clumps present in anti-B and no clumps in anti-A, it is B group. If clumps seen in both the anti-A and anti-B, then it is AB group. And if no clumps seen, it is O group. So O group means it is 0, no antigen. So now here interpretation is opposite. So if you see clumps in A cells, it is B group. If you see clumps in B cells, it is A group. If you see no clumps, then it is AB group. And if you see clumps in both A cells and B cells, it is O group. Now we will see significance of blood group. So significance of blood group, the blood group, everyone should know their blood group because when in accident or in surgery, when too much blood loss is there, then we need blood. So which blood to be taken from donor, we should know that to prevent the hemolysis of the blood or mismatched blood transfusion. Again in pregnancy also, mother and father blood group should be there, because if mother is negative, if father is positive, then if baby is positive, then that D antigen will cross to the mother through the placenta, and in next pregnancy, because of the anti-D, the immune antibodies are formed, and in next pregnancy, D antigen of the fetus will react with the anti-D antibodies and it will cause hemolytic disease of newborn. Again for identity purpose also, for medical legal purpose also, this blood group should be known. Now little bit about Rh antigen. So Rh antigen, it is discovered in rhesus monkey, and when one drop of blood is taken, one drop of anti-D from the kit and see for the clumps. So if you see clumps, it is Rh positive. If you see no clumps, it is Rh negative. And natural Rh antibodies are not present. They are immune antibodies. When the Rh negative person gets exposed to Rh positive blood, then there is formation of antibodies, and then that is called as Rh antibodies. So it can be seen in mismatched blood transfusion or hemolytic disease of newborn.
U test. So DU means unknown. So some Rh positive cells fail to show macroscopic agglutination by usual methods, and by mistake these are categorized as Rh negative. So there is determination of DU by tube method, that is ICT, indirect Coombs test. So few procedure: first, prepare 5% suspension of red cells in isotonic saline. Second, label as T and then add one drop of anti-D serum. Then third, label second tube as C and add one drop of 22% bovine albumin. And then fourth, by using Pasteur pipette, add one drop of cell suspension to each of the two test tubes. Mix well, incubate for 5 minutes, 15 minutes at 37 degrees Celsius, and then wash cells 3 times with normal saline, and then completely decant after the last wash. And then to each tube, add 2 drops of anti-hemoglobin. Mix the contents and then centrifuge for 1 minute and resuspend, and then see for the clumps macroscopically and microscopically. So if entity bovine albumin both no clumps, then it is D Rh negative. If entity shows clumps, then it is positive, and if both shows clumps, then it is invalid. So clinical significance of first donor typing, weak D is much less antigenic in comparison to D, capital D. However, DU red cells may be destroyed if transfused to person already having anti-D. Also, DU red cells, if transfused to D negative patients, can sensitize them, which can cause HTN later if D negative female of the reproductive age group. Hence, weak D testing has to be done on all D negative donor units before transfusion. Those that turn out positive should be labeled as RHD positive. Recipient typing, there is controversy in handling weak D recipients. Weak D testing is currently not required for recipient. The weak D recipients are classified as RHD negative and safely transfused with RHD negative blood. Some centers choose to test recipient for weak D also and transfuse weak D recipient with weak D positive blood. Weak D testing in infants. Weak D positive infant can suffer from HDN if mother possesses anti-D antibodies. Weak D testing in newborns plays an important role in determining who should receive anti-D immunoprophylaxis with Rh immunoglobulin. In newborn infants of Rh-D negative mothers are tested for D and weak D, and Rh immunoglobulin is recommended for mother of D positive or weak D positive infants to prevent potential immunization.
So the significance of cross matching is to prevent transfusion reactions like hemolytic reactions which occur because of the mismatched blood transfusion. So now types of cross matching, there are two, major and minor. So in major cross match, donor cells are mixed with patient serum. So in that, donor's antigen is going to react with the patient's antibody. In minor cross match, patient cells are mixed with donor serum. That means patient's antigen will react with the donor's antibody. Now see the steps of cross match. So first we have to take these cells and serum suspension in saline and keep at the room temperature for half an hour. Then these test tubes we have to keep at 37 degrees Celsius for half an hour. Then we can add bovine albumin 22% and keep test tubes for half an hour in the incubator. Then we can add papain enzyme and then again keep the test tubes in the incubator, and finally we can add Coombs serum, that is anti-human globulin serum, in the test, and then keep that for the half an hour in the incubator. So procedure, we have to take 5% cell suspension of patient and donor's blood, and then in major we have to add 1-2 drops of donor cells and 1-2 drops of patient serum. In minor tube we have to add patient cells and donor serum. Then keep these test tubes in incubator at 37 degrees Celsius for 30 minutes and then see for clumps macroscopically, that means visually,
by just mixing the reagents in the test tube, and microscopically, that means take one drop of each major and minor on the slide and then put cover slip and see under microscope. If clumps are there, that means it is not compatible. If no clumps between RBCs is seen, that means the cross match is compatible.
Direct Coombs test principle. This test detects antigen on RPC, uses hemolytic disease of newborn, detect hemolytic anemia, investigation of mismatched blood transfusion. Procedure: preparation of cell suspension in normal saline. Second, washing of red blood cells in normal saline. Then third, add 2 drops of Coombs serum to red cell bottom. Fourth, mix well, centrifuge and see for agglutination. Indirect test to detect antibodies in serum uses blood grouping to confirm Rh negative group. DU test is done similar to indirect Coombs test. Cross-matching test using Coombs serum, investigation of mismatched blood transfusion reaction, detect and titrate anti-D antibodies in hemolytic disease of newborn, detect and titrate anti-A, anti-B antibodies in ABO incompatibility. Procedure: take 3 test tubes labeled as T, BC and NC. T, add 2 drops of patient serum. NC, 2 drops of normal saline. PC, 2 drops of anti-D. Add 2 drops of Coombs control cells to each tubes. Coombs control cells are the O positive cells when washed with the normal saline. Then keep all test tubes in incubator at 37 degrees Celsius for 30 minutes. Then wash all cells 3 times with normal saline. Add 2 drops of Coombs serum in each tube. Mix and wait for 10 minutes and centrifuge and see for agglutination. If agglutination present, then it is positive. Then you have to go for the titration. If agglutination not seen, then it is negative. When indirect Coombs test comes positive, then titration of antibodies is required, and then it is done similar way as the indirect Coombs test. Only difference is that you have to take the serum dilution in at least 4 or 5 test tubes, and then you do the procedure same as indirect Coombs test, and then the highest dilution where the clumps are seen is called as the titer.
Hope you find this session useful for your understanding and for your exams. Thank you.